Welcome to the Value-Based Care Perspectives podcast. In this show, award-winning healthcare executive Rani Khetarpal will take you on a journey of exploration, focusing on the value-based care landscape and healthcare transformation. Here's your host, Rani Khetarpal.
Hello and welcome to the inaugural episode of Value-Based Care Perspectives. My name is Rani Khetarpal and I am thrilled to be your host for this podcast series. So let me just start by saying what an amazing time to be in healthcare. I mean, the evolution we're in how we're looking at care delivery is nothing short of extraordinary. And at the epicenter is really this concept of value-based care. And that's really what this show is about, is really picking value-based care apart, understanding all the different components and pieces of that puzzle by talking to people that are in it right now from various angles and perspectives and bringing it all together and hopefully be able to take away some pearls of wisdom, if anything, to really understand just how complex this transition from fee-for-service to value-based care is in reality. The concept, as we know, is fairly simple, right? A balance between cost and quality, so quality-driven care. But what does that really mean? I feel like we do a lot of just throwing around phrases without really understanding what the true definition is of it. And I do believe, though, that with value-based care, among other things, that if you ask someone what it is, you're going to get one answer. And so it really just depends on what their perspective is, how they have experienced value-based care, whether they're delivering it or supporting it or experiencing it, either way, or shaping it, right? It's all going to depend on the person you speak to. So I'm really looking forward to this show and really diving into different opinions and perspectives and the diversity of work that's going into creating a successful value-based care model. So I thought I'd spend this first episode just talking just briefly about my background and why we're here, and then a little bit about what to expect from this show as we move forward. So with that, just a little bit about me. I have a couple decades now of experience within healthcare. I started in pharmaceuticals, carried the proverbial bag, as we like to say, in field sales, and worked my way up through various roles in different organizations, ultimately becoming a national leader within the oncology space for a very large manufacturer. And then after that, I actually stepped away from pharma and started a company. It was actually a provider organization that delivered clinical transitional care. And that was really solidified my foray into the value-based care world. That post-acute care was becoming so important as different bundled payment models were introduced, as readmissions became really the key to reimbursement success, if you will. And so that was really kind of the first real taste I had of the importance of value-based care and where it was really going. We eventually got acquired and I went back into pharma and then left again, and am now working for an organization that, lives and breathes alternative payment models and risk and all things value-based care, and intimately involved in the oncology and cardio space with APM models. But, what's interesting is that what I've come to realize in working in post-acute care and oncology and cardiology is that, the basis of value-based care is looking at the patient holistically. So even though you may be concentrating on a certain disease state, you really do have to pay attention to everything else, all the other comorbidities that need to be managed, including not just clinical factors, right, but all of your psychosocial factors, your financial factors, social determinants of health, all of these things that actually play into delivering and experiencing quality-based care. So that's been a learning over the course of the last few years for me. If I were to say that's the one pearl of wisdom, is that, even though your focus may be one therapeutic area, you really have to look at it holistically. So Why this show? How did this come about? Well, about a year ago, I was invited to do a podcast with a gentleman by the name of Adam Torres, who owns the Mission Matters franchise. Adam hosts a podcast that brings on business leaders from all different backgrounds and industries and, just lets them sort of educate folks on what they're doing. So he invited me to come on the show to talk about oncology and value-based care. And so at that point, shortly thereafter, he reached out again and said, hey, I'm going to be putting together this book. It's a women in business book. There's going to be several authors on it. I'd love for you to do that. And so, of course, I couldn't say no. And so I went ahead and authored a chapter in this book. If you haven't read it yet, or if you're curious about it, it's called Women in Business. It is part of the Mission Matters franchise. You can search by my name on Amazon and it will pop up. Shameless plug. But in all seriousness, if you haven't read it yet, or you're looking for a good business read, this is several women authors that are sharing knowledge across various topics, and just really amazing, accomplished women. So I definitely encourage you to pick it up, and it's a very quick read, and I think you'll really enjoy it. But the chapter that I wrote was on value-based care and oncology from a patient's perspective. So I wrote it as if a patient was reading it so they could really understand these changes that are happening in cancer care and how cancer care is being delivered. And subsequently thereafter, I was asked to host this show. And so the real crux of the show is not me talking for a half hour on every show, thank God for that, but is really bringing on guests from all different aspects that are involved in the value-based care world. So payers, providers, patients, patient advocacy representatives, policymakers, anyone and everyone that is involved in shaping up what is, what this new care delivery model is looking like. I'm really looking forward to hearing successes, but I'm also looking forward to hearing failures. What hasn't been working, right? I think we learn the most from what we did wrong. And so I'm looking forward to putting all those pieces together. I also would very much like to see this show take stories from outside the U.S., right? Bring on guests and see what's happening outside of our borders. That value-based care is starting to gain traction in other countries, and so it'd be very interesting to see how other folks are approaching it, because most countries are where we were about 3 to 5 years ago. And so really kind of backtracking and playing 2020 or Monday morning quarterback gives you 2020 vision, right, is really understanding what's happening out there globally in this space. So those are kind of the ideas that I am looking to bring forward. Having said that, I would love to hear from you and would love to hear what type of topics you would like to hear about. And you can do that by logging on to the website, vbcperspectives.com. That's vbcperspectives.com. And just go ahead and shoot me a message and let me know what subject that or topic you'd be interested in. If you would like to be a guest or know someone that would, please let me know. This is just as much your show, and this show is for you, and I'm looking forward to making it relevant for everybody out there. So in closing, I just want to say thank you for finding this show. Thank you for listening. And please, check back frequently. Subscribe to our alerts on our website. It will alert you when there is a new episode that's been uploaded. And please do contact me if you have questions or suggestions. And really looking forward to embarking on this journey of learning with you. Thank you, everybody, and be well.
We hope you enjoyed this episode of the Value-Based Care Perspectives podcast. To learn more about value-based care and healthcare transformation, or if you'd like to be a guest on the show, visit www.vbcperspectives.com.